Can you guys hear me? Hello?
Yes, sir.
Okay. So, Dr. Mehreen, can you please give us a quick overview of penicillin? This picture.
Okay, sir. Uh, there is a broken pencil which gives us a reminder about penicillin, and there is a beta lactam ring on the pencil.
Okay, just tell me. We have penicillin, it have beta lactam ring, it's going to inhibit transpeptidase like that.
Okay,
Just look the picture and just tell me quickly.
there is a pencil which shows the pencil which indicate the penicillin group, and they have a beta lactam ring which inhibit the transpeptidase enzyme.
Okay.
Uh, uh,
And it's going to inhibit DLR, right?
yes, sir.
Like it's DLR analog, it's going to take the place of DLamine therein, and as a result of that, it would inhibit the formation of cell wall, right? This child kicking off the ball.
Yes,
Okay. Can you just tell me the types of penicillin?
penicillin B, penicillin G.
Okay, V is oral or intramuscular?
B is oral. B
Like
is
what
oral,
about?
and the
Okay, can you just
penicillin
tell
G
me
is
some
intramuscular.
adverse effect of penicillin?
The nephrotoxicity and the
Okay,
hypersensitivity reaction.
okay,
It
hypersensitive.
also causes pseudomembranous colitis,
Okay, and
hemolytic.
hemolytic.
Yes.
Okay, good. Okay, so anyone else who can just tell us the mm, resistant penicillinase resistance and sensitive penicillin, please.
Okay.
Hello. Yes, doctor.
Okay. So the penicillin is resistant. Sorry, we started with sensitive. So the penicillin is sensitive. Antibiotics include ampicillin and
Perfect.
amoxicillin.
Perfect.
The penicillin resistant antibiotics are nafcillin, methicillin, and oxacillin.
Perfect. Okay, can anyone just tell me the penicillin which are used in pseudomonal infections? Dr. Zainab, please. Hello, Dr. L Futures. Let's be quick, guys. Today we are going to do boot camp as well, please.
I
It's
think
piperacillin.
picaxilin and piperacillin.
Piperacillin.
Okay, they are penicillin sensitive or resistance?
Resistant?
They are
Yeah,
sensitive.
sensitive.
Penicillin sensitive.
They are sensitive. If you remember that the broken pencil. How can you forget that picture, guys? Broken broken pencil. Okay, so anyone who can just tell me the cephalosporin class 1 drugs, their action and everything. Doctors, anyone? Dr. Sahina, Dr. Renu. Hello. Guys, please participate, guys. What happened?
May I try?
Yes, yes, please.
We have four generation penicillins. First generation, cephalosporins.
Okay.
Due to we know by peak with where chief. Chief means cephalosporin. First
Okay.
generation cephalosporin is cefazolin.
Okay,
We
solid.
use for
Perfect.
gram-positive bacteria,
Okay.
mostly, and we use for uh, as in a first line drugs.
Okay. So
Also,
gram
we
positive for
use,
right?
gram-positive,
And
covering
basically there are
gram-positive.
two drugs. Cefazolin and
Cefadoxil,
Zaxin, licking that jam.
cefa,
One C licking jam. How can
mhm.
you look the cephalaxin?
Yeah, cefalexin, leak,
Okay.
yes, leaking.
Okay, so can you just tell me the class 2 drugs, cephalosporins?
class 2 drugs, cefuroxime,
Okay.
Cefaclor,
Yes,
cefaclor,
perfect.
covers
Cephalosporin. What about that Oxford book?
Cefoxitin.
Duloxetine.
Okay, Cephalosporin. Okay.
yeah,
See this Oxford book and
cefoxitin, yes,
your daughter.
cefoxitin, yes.
Okay, they are also used against gram positive. So can you tell me
Gram
class
positive.
3 cephalosporins?
Cephalosporins, ceftriaxone, ceftazidime.
Okay. They are used
Also,
against which bacteria?
cefoperazone, gram negative, gram positive.
Perfect.
Also against Pseudomonas aeruginosa,
Okay, which one is used against Pseudomonas? Ceftriaxone or ceftazidime?
ceftazidime was.
Okay, perfect. And three conditions in which we were using ceftriaxone.
Ceftriaxone, meningitis.
Perfect.
Also
Lyme
Lyme disease.
and
And
gondolas.
yes, and last one was
Gonorrhea.
Gonorrhea.
yes, gonorrhea.
Okay. Okay, can you just tell me class 3 cephalosporins?
Class
Okay, what's the name?
class
Class 4,
class
sorry.
3 or
Class 4.
so 4, yeah. Cefipim.
Oh, yes, cefepime. Okay, they are used against which kind of bugs? Positive or negative?
Negatives more
Both.
against
Both
gram
positive
negatives.
and negative.
Yeah.
Eggplant and red tomatoes and against pseudomonal infections. Can you just tell me the cephalosporins class or fifth generation?
The fifth generation.
Ceftaroline.
Okay, perfect. Ceftaroline.
Positive.
Can you just tell me they are used against MRSA, right?
MRSA.
MRSA species.
Okay,
Yes.
and both gram positive or negative?
Both.
Both.
Yes,
Both.
both. Perfect. Okay, so anyone who can just tell us the aminoglycosides?
Aminoglycosides. These are also bactericidals.
Okay, they are inhibitors of 30S or 40 or 50S? Right?
30.
30s.
30, perfect. Okay, can you just name the drugs, Dr. Renu?
Yeah, sure, Dr. Ahmed. So the drugs of the aminoglycosides are the amikacin, the
Okay,
streptomycin, the
perfect.
neomycin,
And
and
gentleman,
gentamicin.
perfect. Okay, so can you just tell me the adverse effect of aminoglycosides?
Yeah, adverse effects.
Okay, they are used against aerobes or anaerobes?
Aerobes.
Okay, what are the side effects? Man coming out with both of his fingers.
Ototoxicity.
Perfect.
Ototoxicity.
Autotoxicity.
Nephrotoxicity.
Kidney being
Nephrotoxicity.
yeah,
Perfect.
nephrotoxicity.
Okay,
And it's also teratogenic.
teratogenic. Perfect.
And then neuromuscular blockade will lead to
Neuromuscular
paralysis.
blockage. Perfect. Perfect. Okay, so this was all about. Okay, can anyone just tell us about this tetracyclines? Hello.
They also inhibit the 30S ribosomal subunit.
Okay, perfect. It inhibits 30S. Can you just name the drugs?
Tetracycline, doxycycline.
Okay, with the cycline. Oh,
Cycline.
okay,
Yes.
subsection. Okay, can you just tell me what are some of the adverse effects of tetracycline?
Teratogenic also.
Teratogenic. Perfect.
Dental
Discoloration of
dental
teeth.
extraction.
Yes.
So can we just take it with antacids? That Tums.
No, milk and
No.
antacids decreasing the pharma effect.
Yes.
Okay, perfect. So, and what about that sunburns, photosensitivity? It
Yes,
causes
these are
photosensitivity as
photosensitive.
well. Okay, so okay, let's just take this. Okay, just give me a second. Okay, so in this scenario, first of all, you can see that it is somewhere in America, and there are 50 states here, right? Okay, so you must remember, like there is a map on which there is written 50 states, and they have just indicated with pens all of the 50 states. Simple. Okay, so basically they are playing a game here, like it's a kind of a mini type of party. Okay, and what's this guy doing? This guy is throwing something. You know, he's throwing something in order to have some, in order to win some juices. Simple, you can think of, like these are some juices there, and they have just set up a competition that whoever throws something onto the juice, so you can get that, right? And in the party they are enjoying it with macaronis, right? Okay, so this guy also is like, just he's just pulling the lever in order to change these, like you can just imagine of, he's just pulling the lever in order to bring off these juices in front of him. Like they have just set up a certain kind of setup in which whenever he pulls the lever, so the juices are put onto the target simply, and he is going to throw some things in order to win those juices they are enjoying with macaronis. Okay, so you can see that here, this female have a funnel type of thing, which is basically like you can sip things with this funnel kind of thing, right? That's CYP. You can sip. Okay, for example, you can sip juices with it. Simple. You can, so this thing basically indicates you are sipping. CYP. Simply you can think of. Okay, so here this woman is having some GI upset. So this was the whole scenario. Now let's um, study that what drugs are related to this scenario. First of all, okay, okay, just give me a second. Hello. Okay, so this macaroni basically indicates macrolides, right?
Mhm.
Hello.
Yes.
Okay, so in this scenario, you can also see this twisted kind of, this strap, which is basically like for the decoration purposes. Some people in the parties they just arrange like a twisted kind of this strap. Okay, so you must remember this as well. So macaroni basically indicates your
Uh,
macrolide. Okay.
sorry,
Yeah.
I can't see your screen, Doc.
Okay, you can't see my screen.
Yeah,
Okay. Uh, can you
are you
guys see my
sharing?
screen? Hello.
No.
No,
Okay. Can you guys see it now?
no.
No.
No. Just give me a second. Hello. Hello. Can you guys see
I
it?
too can see it.
Okay.
I can see. I can see.
Okay. Good. So, so like in this scenario, you can see this twisted kind of strip, which is basically like used for some kind of decoration purposes. Okay. So the macaronis basically indicates the macrolides drugs, right? So we are studying macrolides in this scenario. This guy is throwing something in order to win these juices. Simple. So the throwing must remind you that all of the drugs in macrolides have throw throw in their name. What do I mean by throw? That is promycin, azithromycin, clarithromycin, erythromycin. Okay, those drugs who have the word thromycin in them, they are basically macrolides. Simple. Okay, so macrolide have the word throw in their names. You can simply think of the guy throwing. Okay. Okay, so you can see the 50 states here. It means they are going to inhibit the 50S ribosomes. You know, ribosomes have two parts, the 30S and the 50S. So, for example, if they are inhibiting the 50S, it means they are bactericidal. They are inhibiting the enzyme synthesis of bacteria or the protein synthesis of bacteria. So, they are bactericidal and the inhibits the protein synthesis simply by inhibiting their 50S ribosome subunit. Simple. So, macrolides, there is the word throw in their name. For example, azithromycin, clarithromycin, erythromycin. Okay, they are going to inhibit the 50S because I'm somewhere in America and it have 50 states simply. So they are going to inhibit the 50S portion of your ribosomes. Okay, what are some of the side effects? You guys can see here in the picture. This guy was just pulling the liver in order to change these juices. Okay, right? In order to just change, bring a new tray of juices simply. So pulling of the liver should remind you that it causes hepatotoxicity. Like liver can be like you can it sounds similar to liver, right? Liver for liver. So it causes hepatotoxicity. Secondly, this woman you can see like she was having some GI upset. She was vomiting. So it can also cause vomiting as well. And here I was just indicating this funnel. Though, so this funnel is basically used for sipping, right? For example, if I want to sip the juice, okay, I want to take sip, so I can use this funnel kind of thing simply. So this CYP basically indicates the cytochrome P50, cytochrome P450, right? Basically, you guys know they are present in liver, and many drugs are being metabolized by your cytochrome P450, right? So there are certain drugs which inhibit cytochrome P450 or CYP. So, for example, if I inhibit this CYP, it means I will be having more chances of toxicity, right? If I am inhibiting CYP. So, macrolides are basically CYP inhibitors. They inhibit CYP, so it can cause drug-drug interaction. For example, if I have two classes of drugs, let's suppose one macrolides and other kind of drugs. If I am inhibiting this CYP, it means the other drug which I am using, it's going to increase in their concentration and it's going to cause toxicity simply. So it can cause drug-drug interaction. Here you can see these twisted waves. So these twisted waves basically indicates torsades de pointes. As the name indicates, what's torsades de pointes? The QT interval prolongation, and you are going to see twisting of waves. So it can also cause prolongation of QT interval and torsades de points. Simple. Let me give you a quick overview again. We have macaronis, which indicates macrolide. You are going to see the word throw in their name. Why? Because this guy is throwing in order to win some juices. Okay. So he's pulling the lever. Okay, it's going to inhibit the 50S portion of ribosomes, and as a result of that, it inhibits the protein synthesis. This guy is just pulling the lever, so liver can be it sounds same as liver, so it causes hepatotoxicity. Okay, it's CYP inhibitor, cytochrome P450 inhibitor, so it can cause drug-drug interaction. We'll be doing the details in the general pharmacology, but here you guys must know that CYP, P450 enzymes, they're basically present in the liver. They metabolizes different drugs and different substances. So some of the drugs can act as inducer, that is increasing their activity. Some of the drugs can inhibit their activity. So basically, macrolides inhibit their activity. So they are inhibitors. So it can cause toxicity of the other drugs which are metabolized by the same enzymes. Okay, it can also cause GI upset and torsades points. Okay, anyone who can just give us an overview of macrolides, please?
Okay, so macrolides, antibiotics, they contain the name throw. As you can see, the man is throwing the ball.
Okay.
So they include azithromycin, erythromycin, clarithromycin. They work by inhibiting the 50S ribosomal subunit, as you can see, 50 states. They also, so side effects, they are hepatotoxic. The
Okay.
man is pulling down the liver. They also cause GI upset. The lady is vomiting. And they also inhibit CYP enzyme. And they also could cause torsade point.
Okay, perfect. So, okay, this was all about macrolides. Dr. Renu, can you just give us a quick overview again, please?
Okay, so macrolides, they include the name throat, so that includes the azithromycin, erythromycin. They inhibit the
Okay.
50S ribosomal subunit of bacteria. They are hepatotoxic. They cause GI upset. They inhibit CYP enzyme, and then they cause torsade point.
Okay, perfect. So, it was all about macrolides. So, now let's discuss another class of drugs that is okay. Okay. So in this scenario, you guys can see that. Okay, just give me a second. So in this scenario, you guys can see that there is a man who is like going out for some kind of date. Okay, he just carries some chips with himself. Okay, like you can simply think of like they are like husband and wife. Okay, they are going somewhere to a party simply. Okay, so he just carries some chips with himself, and our wife is carrying some flowers. Okay, in order to go for a party, and he's also carrying that sip with himself, that funnel, in order to sip some juices there in the party simple. Okay, but due to like he just put like he just take this sip like quite after a long time, so a tarantula is sitting inside that sip. you guys must you guys should guess that what's happening, but he just take this CYP, okay, or the sipping funnel after a long time. So tarantula is setting. Okay, you guys can see here. You can also see that webs. It indicates that he is taking it after a long time. He is carrying chips with himself. The wife carrying flowers with herself, and the one child is just crying that please don't go. Okay, don't leave me alone. So what did he do? He just catches his tendon, his Achilles tendons, that please don't go. Or in other words, you can say he catches his socks and he just tear his socks. Okay, that don't leave me alone simply. Okay, he also fell off, and in that process he just breaks some of his teeth as well. Simple. Okay, you guys can see here we have a burger on the table, that is a gyro burger. Okay, gyro burger. There are also some terms present, like in the last picture we just assume that terms are antacids, right? They're antacids. Okay, so you can see that a girl here, she's just like she have a top with herself, and she's just like playing with the top. Okay, she's playing with the top, and in her hand she have a flox. Okay, like a kind of that teeth cleaner kind of thing, that is flox. Simple, you guys can think of. And here also we have, for the decoration purposes, that twisted kind of strips, right? So first of all, this scenario is basically related with fluoroquinolones. How to know that this scenario is related to fluoroquinolones? Here you guys can see this lady carrying some flowers. So flowers for fluoroquinolones, right? Okay. What's the mechanism of action? Okay. So in the fluoroquinolones, in all of the drugs, you are going to see the word flox in them, like floxacin, levofloxacin, ciprofloxacin, right? Hello.
Yeah.
Yes,
Yes.
yes.
So you guys are going to see the word flox in their name, floxacin. Okay, in the ending you are going to, in the end of name you are going to see flox or floxacin. Simple. So that indicates the fluoroquinolones. Whenever you see the word floxacin, simple. Okay, what is their mechanism of action? So here we were seeing some gyro burger, and tops this this child is playing with the top. So basically, that inhibits two enzymes: your gyro burger for DNA gyrase, and top for DNA topoisomerase. Okay, as you guys know that gyrase play an important role in replication and DNA replication, DNA synthesis. Okay, so if I am inhibiting gyrase, it means I am inhibiting DNA synthesis. Secondly, topoisomerase. You know that topoisomerase basically help in uncoiling of your DNA. Like the DNA is normally super coiled. So in order to undergo replication, first of all you have to uncoil that DNA. So if I am inhibiting both of these enzymes, it means the DNA cannot be formed. If the DNA, or I am just disrupting DNA synthesis, if I am disrupting DNA synthesis in like certain bacteria, for example, so it can be bactericidal. By inhibiting DNA synthesis, DNA, the bacteria cannot survive. Simple. Okay, so this is the mechanism of action of fluoroquinolones. Okay, so you cannot take it with antacids. Why? Because again, it decreases the absorption of fluoroquinolones inside your GIT. Whenever you take it with antacids, it would decrease the reabsorption of these drugs. Okay. Hello.
Yes.
Yes.
Okay.
Okay. Again, what are some of the adverse effects? Okay, very high yield. You must know, you are going to see a ton of MCQs related to it. Okay, you guys can see this child is just holding the, his dad's socks and tearing the socks. So simply, it basically indicates the tendon rupture. So it causes tendon rupture. Very high yield. Okay, very high yield. So it causes fluoroquinolones causes tendon rupture. Whenever you see that a guy in the scenario have some tendon rupture, he is on certain medication. So you must think of fluoroquinolones. Okay. So it causes tendon rupture. Secondly, you know that this guy have the teeth be are broken, so it inhibits the bone development. It inhibits bone development and teeth development. Bones and teeth development. Simple. Okay, so this guy is carrying some chips with himself. So chips should make you remind ciprofloxacin or ciprofloxacin. Simply you can think of. So chips basically remind of ciprofloxacin. So only the ciprofloxacin inhibits your CYP enzymes. You can see this funnel, this CYP used for sipping. So whenever it inhibits CYP enzymes, so it can also cause drug-drug interaction, right? Okay, so he's carrying this sip after a long time. There is a tarantula setting in the this funnel, so it means it's a teratogenic too. So you must avoid it in during pregnancy, right? Okay, you can see these twisted waves, so it can also cause torsades points. This is very high yield. You are going to see this too. Okay, that macrolides can cause torsades points as well as ciprofloxacin can also cause torsades points, right? Okay. This was the whole scenario. Let me give a quick overview again. Flowers for fluoroquinolones. In their name, you are going to see the word floxacin in the end. Okay, what's the mechanism of action? They are going to inhibit the gyro burger, that is gyrase, and top for topoisomerase. So in this way, they are inhibiting the bacteria. How? Because they are inhibiting the synthesis of DNA. If the DNA is gone, it means your bacteria is gone. Okay. What are some of the adverse effect? Tarantula, especially your ciprofloxacin chips. You can think of. It can cause torsades points. You cannot use it with antacids. It can also cause tendon rupture, very high yield. Okay, and it inhibits the bone and teeth growth. Okay, Doctor Ramesh, can you just give us an overview of fluoroquinolones, please?
Yeah. So first of all, there was a flower bouquet. So these are fluoroquinolones, and the mechanism of action is like there is a gyro burger, so it inhibits gyrase, and
Okay.
there is a top, so it inhibits bacterial topoisomerase, which prevents DNA unspiraling,
Okay.
and there and there's the side effects are like it is teratogenic because of the tarantula, and there is like a tendon rupture, uh, the delay in
Perfect.
the development of bones and teeth in child, and it is inhibited no, inhibits CYP2 enzymes, and there
Okay,
is a risk
CYP enzymes. Perfect.
CO and there is a risk of torsades disappointments.
Okay, perfect. So it was all about fluoroquinolones. Okay, so now let's do our next drug class. That is okay. Okay. So in this scenario, you can see that this lady has just come to a pool. She's enjoying her weekend. Okay. So basically, she's in US. Okay, and US have 50 states. Simple. You can also see this dog. He's just carrying some, like he's just eating some kind of this broken bones. Okay, he just have hold some bones in his mouth. Okay, he's coming on the this ramp. You guys can see this is your ramp, and he's just jumping into the pool. For in order to have a good pool, you must just put chlorine inside the pool, right? In order to just disinfect it. Simple. So this dog carrying some bonds. This is US, 50 states. Okay, so this lady, you can see she's just having a empty cup of wine. There is a like single sip left in the cup of wine. Okay, she's also looking in her old TV, some video recording of her baby. You can simply think of, okay, when she was too young, so she had a black and white picture, so she's looking to that. Simple. Okay, you have some broken bones. Simple. So the chlorinated pool plus this ram should make you remind the drug chloramphenicol. Chlorine, chlor, ramp for chloramphenicol. So we are going to discuss chloramphenicol, right? Hello.
Yes.
Okay. So chlorinated pool plus this ram, it's going to make you remind your chloramphenicol. What's the mechanism of action? There in US 50 states. It inhibits the 50S ribosomal subunit. So as a result of that, it inhibits the protein synthesis, right?
Yes.
Okay. So here you can see this lady, she have a cup of wine and it's empty almost. So empty cup of red wine should indicate that you have less blood. Less blood basically indicates anemia. So what are the adverse effects? It can cause anemia, right? Hello.
Yes.
Okay. Secondly, she is just looking to her old pictures that is in black and white kind of scene. So it causes gray baby syndrome. Okay, it causes gray baby syndrome. You guys must remember we are going to do the details of gray baby syndrome, but till now you must only know it causes gray baby syndrome. Okay, you have some broken bones. This dog is carrying the broken bones with himself and he is jumping into the pool. So these empty, broken old bones should make you remind of aplastic anemia. What happens in aplastic anemia when the bone marrow is disrupted? All of the cells, all of the hematopoietic stem cells are going to be disrupted. So it means it's going to cause aplastic anemia, the chloramphenicol. Let me review this drug again. Chlorinated pool with RAM, chloramphenicol. Mechanism of action, it inhibits 50S ribosomal subunit. So it inhibits the protein synthesis. The lady carrying empty glass of wine should make you remember that it causes anemia. Red wine, less blood, or anemia. It also causes gray baby syndrome. Secondly, it can also cause aplastic anemia. So anyone who can just give us an overview of chloramphenicol, please?
Okay.
Well, first of all, that
Um,
Okay,
someone
yes.
okay,
speak.
go on.
Okay,
Go ahead.
Dr. Soma, please can you tell us?
Okay. From the picture, we can see a dog that is stepping on a chlorine ramp. So the
Okay,
class of drugs we are discussing is the chloramphenicol.
perfect.
Then we can see the flag of the United States, so 50 states. So it shows
Okay,
that it inhibits 50S ribosomal subunit of
okay,
the bacteria. Then there's
perfect.
a lady with an empty glass of wine. It causes anemia, and she is
Okay,
looking at a black and white picture of a
okay,
baby. So it causes gray baby syndrome.
okay,
And
perfect,
then the dog has some broken bones, which signifies that it causes aplastic anemia and bone marrow failure.
perfect. Okay, okay. So it was all about chloramphenicol. Now let's discuss another drug. Okay, and today we'll be almost finishing off this discussion on drugs. Okay. Okay. So let's do this. Okay, so it's a kind of okay. Okay, so in this scenario, you can see that some archaeologists are have come to the site where they're trying to find something, right? So you can see he has just carried a book with himself, and the book have that ring within itself. Okay, you guys know what am I talking? Ring for beta lactam. Remembered, guys? Okay, he's also having a mechanical pencil because at this sites like for example if he's visiting these kind of sites, so he need a mechanical pencil so that it won't break, and he's writing down some things what he have found. Simple, he's wearing a monoocular glass simply. Okay, with like in the past, people used to wear these kind of glasses with a single lens. Okay, that is monoocular glass. Okay, so he just found a sign. You guys can see like this is a historical sign, and basically this sign is known as Aztec sign. Like a certain individual in Mexico, they like indicate there is a historical sign which is known as Aztec sign, and they usually like consider it as a sign of God. Simply think you can think of it's Aztec sign, right? Okay, so they were just mining something, so of a sudden they just broke out the wall. The wall is broken, and there were some red chilies that were growing upon this wall. You can also please remember this too, the red chilies growing off from the wall. So they find this Aztec sign. So one of their worker just went there and he just put his hand on the Aztec sign. So what happened as a result of that? He had some rash. So suddenly his rash started healing off. You can see like it was a kind of sacred. They just considered it as a sacred kind of sign. So he touched this sign, and of a sudden, what happens that he just was recovering from that infection kind of thing. You guys can see that he have some rash on his skin. Okay, so here we are basically talking about certain class of drugs that are known as monobactams. Monobactams. How do we know that we are talking about monobactams? The monoocular glass should make you remember that we are talking about monobactams, right? And what are some drugs that are included in monobactams? The Aztec sign, that is astionam. Astionam. It is one of the monobactam. Okay, it's used against. Okay, it have beta lactam ring, right? And its penicillin is sensitive. Okay, what's the beta lactam ring? It's an analog of DLR. If you guys remember, DLR is the sequence which is basically found in the cell wall, right? So it's like same as that of penicillin, because penicillin also have beta lactam ring. So it can act as DLR analog, and they can just sit off in this chain while the formation of wall. So it can inhibit the cell wall synthesis. How to remember that this wall is broken? You guys can see. So it basically breaks the bacterial cell wall. Okay, they are used against rod-shaped gram-negative bacteria. How should I remember that? Here you can see the rod-shaped chilies, red chilies growing off from the wall. So it should make you remind that we are talking that basically we use monobactams, one of which is Astronom, against gram-positive rod-shaped bacteria. Simple, right? Hello, hello.
Yes, yes.
Okay, and it this.
Yes.
Hello,
Yes.
your voice is too low.
Yes, we can hear you, doctor.
Okay. So let me repeat it again. Here in this scenario, some of the archaeologists are finding some stuff. Okay, that's historical stuff. So they came to the site. He just wear a monoocular glass. So this monoocular glass should make you remember. We are talking about monobactams, antibiotics, right? Okay, they just found an Aztec sign, like it's was a sacred kind of sign of some people. You can just simply think of Aztec sign. Okay, so one of the drugs which are included in monobactam is Aztec for Astionam. It should make you remember Astionam drug. Okay, they are used against gram negative rod shaped bacteria. How? They have the beta lactam ring here. You guys can see, and beta lactam ring is DLR analog. It's going to inhibit the cell wall synthesis. Already discussed in penicillin, right? Hello, sorry.
Yes, yes.
Okay, they are penicillinase resistant. You guys can see the mechanical pencil was indicating the resistant form of penicillin, right? Or resistant form of penicillinase resistant antibiotics. Okay, red chili should make you remember the gram negative rod shape. Okay, they are also used in treatment of some allergic reaction caused by penicillin. We have already discussed. Penicillin would cause some hypersensitivity allergic reaction causing these rashes, hypersensitivity. So manobactams can be used or they can cure these allergic reaction. Here you can see how to remember that. One of the guy is just putting his hand on that Aztec sign, and he is recovering from this infection, that kind of articarial rash. So it means that Aztec is going to treat the hypersensitivity or allergic reactions that are caused by penicillin. Okay. So anyone who can just give us an overview of monobactams, please. Hello. Hello. Dr. Ramiz.
Yes. Uh, so first of all, there is an archaeological site, and since there is a presence of monoocular spectacle, so it suggests that we are talking about monobactams, and
Perfect.
there is an Aztec sign, which suggests the name of the drug in this class, that is astronam, and also there is a broken cell, a broken wall, so it suggests that it prevents the cell wall synthesis, and
Okay.
okay, and it does that because it has beta lactam rings, and
Perfect.
resistant to penicillinase because of the presence of that sturdy mechanical pencil, and
Okay.
it is active against gram negative rods because of the presence of that red chili peppers, and it is used for treatment of allergic reactions. If
Perfect.
the patient has penicillin allergy.
Caused by penicillin. We have already discussed that penicillin is going to cause some allergic reactions. Okay, so anyone else who can just give us a quick overview like Dr. Mees? Keep it up, Dr. Mees. Anyone else? Guys, please participate, guys. Hello.
Okay, so I'll go. So this diagram is talking about monobactams. As you can see, the gentleman is wearing the monocle. So monobactams. You see, he's drawing something in the book. So that stands for the drug name as Trionam. And he has a mechanical pencil. So Astrianam is resistant to penicillinase. Um, and it also has a beta lactam ring. Um, we see from the flowers growing that it treats gram negative rods, and
Okay.
we see the man with the rash. So we see that it is used if patients are allergic to penicillin.
Okay. Good. So, okay, so this was all about today's drugs, and we are left with one or two antibiotics that we'll be discussing tomorrow. And tomorrow we are going to start the bacteria section as well. That is like we'll be discussing gram-positive bacteria, right? So we are almost done with the antibiotics. Okay. So Dr. Renu is going to give us an overview of today's antibiotics right from macrolides. Please, Dr. Renu. Hello. Hello, Dr. Renu. Hello. Okay. Dr. Obada, can you just please give us an overview of the
Yeah.
drugs which we discussed today? Perfect. Thank you.
Macrolides, first of all, the mechanism of action, it binds on 50S subunit, bacterial ribosomes, and it inhibit it. It also inhibit cytochrome B450 enzyme, so it causes hepatotoxicity. Other side
Okay.
effects causes GI upset like vomiting, uh, and it causes prolonged QT interval that
Okay. Can you first of all just tell me the names?
okay ends with the thromycin like erythromycin, azithromycin,
Perfect.
clarithromycin.
Okay. So this guy is throwing the ball, right, in order to win their juices. So it means that there would be the word throw in their name.
Yes.
Thromycins. Perfect. Okay.
Other side effect like prolonged QT interval will develop torsades points.
Okay. Perfect. Okay. It's going to inhibit CYP enzymes.
Yes,
Good.
I mentioned.
Can you just tell us about fluoroquinolones?
Fluoroquinolones, it ends with fluoxacin.
Okay. Perfect.
The mechanism of action, it inhibits two bacterial enzymes, gyrase and topoisomerase. Gyrase
Okay.
and topoisomerase share or develop transcription of DNA, so it inhibits
Good.
transcription of bacterial DNA.
Okay.
Side effects, it causes QT prolongation, torsades points.
Okay.
Uh, it's teratogenic, and there is uh, one type that called ciprofloxacin. It inhibit cytochrome B 450 enzyme. So we should not give in ciprofloxacin with the other
Yeah.
with other drugs or agents that causes that inhibit that enzyme. We should also avoid it in intake in children and with using antacids.
Yes. Okay. And what about the names? Fluoxetine.
Yes. Also, there is a important thing that it causes a tendon rupture.
Tendon rupture. Yes. It causes tendon rupture. Good. So, can you just tell us about this picture?
Chlor- Chloramiphenol
Okay.
mechanism of action inhibits S ribosomal subunit and side
Perfect.
it causes a gray baby syndrome and causes anemia, mostly uh, normocytic anemia, uh,
Okay.
like aplastic anemia and bone marrow failure.
Perfect.
Aplastic anemia comes with pancytopenia.
Okay. Perfect. It comes with pancytopenia. Perfect.
Yeah.
So, okay. And the last drug, that is your monobactams.
Uh, okay, monobactams. It it's used against the gram-negative rod, and it
Okay.
has a beta lactam ring, so it's a beta lactam antibiotic, and it's resistant to penicillinase.
Okay.
It prevents cell wall cross-linking. Uh, it's used in the patients with penicillin allergy. And
Perfect.
yes,
Okay, so we are almost done with the antibiotics. So hope so you guys enjoyed this approach. So we'll be doing the microbiology in same way, right?
okay,
Like
Yes.
guys, are you enjoying these pictures and these discussions?
Yes.
Okay, and
Yes.
also it
yes,
would just make you remind like if you are doing. It's been our third day we are doing these pictures. So I think now you are used to these pictures. You know that this basically indicates this and that. So I think it would be quite easy for you guys to start off the microbiology section, right? Okay, and
Yes.
we'll be revising it on daily basis. Okay, this is our first goal because okay, once you just remind all of these pictures, so you can easily answer your MCQs. Okay, just give it a try in your world. So today we are going to do boot camp of hemostasis. Tomorrow we are going to do complete chapter of. Okay, so can you just tell me that have you guys finished off the dermatology?
No, sir.
Okay,
No.
so
Not yet.
last day
No,
remaining, right? Tomorrow.
like today is the last
Yes.
day.
Okay, today was the
No,
last day or
tomorrow is the
tomorrow is last day?
Tomorrow.
Okay,
tomorrow.
tomorrow is last day. So today we are going to discuss the hemostasis. Okay, tomorrow we are going to do the white blood cells along with anemia. Tomorrow we are going to have a long session because we have three systems related with hematology, right? So are you guys done with complete task, right? You aren't missing any day, right?
Yes.
Okay, so that's good. So, guys, we'll be starting off. Okay, first of all, we'll have a grand assessment after dermatology. Tomorrow, day after tomorrow, I'll just give you a single off day. You guys can just prepare, and I'm also going to add these antibiotics MCQs as well in the grand assessment. And I'm just looking out for to have like 80 MCQs in your exam in the grand assessment, right?
Okay.
Okay, so you guys must focus on okay, so pulmonology, right? Pulmo,
No,
immunology. Okay.
you may. Like all systems would be included in assessment.
Yes, we have already done one grand assessment, which includes the that include the I think your cardio,
Cardiovascular,
endo,
endo.
and renal.
Yes.
Okay, so then now we will be doing okay. Now we will be doing our pulmo, immunology, hematology, and dermatology. Four. Okay, so do you guys need 2 off days for that or not? One is enough.
Yes.
2 days.
Okay, so I would just give you 2 off days, and right after that, you guys are going to attempt that grand assessment.
Sir,
Okay, so
two
get
off
prepared.
days means from tomorrow.
Yes, tomorrow would be your off day, and day after tomorrow you have one off day, and then we are going to on the third day we'll be taking the grand assessment. So
So
tomorrow you
and
have off.
Saturday.
Yes. What's the okay? Today is Wednesday, Thursday, Friday. Yeah. On Saturday we are going to take grand assessment. So be ready for that. And tomorrow, it isn't complete off day. We'll be doing the boot camp as well. We'll be
Okay.
revising those. Okay.
Sir, will the assessment open till Monday?
Okay. Don't worry about that. Just get prepared for your assessment, and I'll just give you 3 days to attempt your assessment. Don't worry about that. But tomorrow, today we aren't going to share any task, and tomorrow we aren't going to share any task. Just focus on your revision. Okay, and on Saturday we are going to take grand assessment, but we will be having these boot camps. So let's start off our hemostasis. Okay, we will be very quick. Like we are done with many concepts. Okay, can you just give me a second?
Okay. Thank you, sir.
Hello. Okay. So let's discuss hemostasis. We will be very quick. We have already discussed. So you guys know that we have two kinds of hemostasis: primary and secondary. Dr. Amis, please tell us what happens in primary and what happens in secondary.
Uh, in primary hemostasis, like platelet plug is formed. So there are
Perfect.
different
Okay. Secondary,
Coagulation
stable cord
factors.
from
fibrin or
stable cord. Coagulation is also
okay,
there.
Coagulation.
coagulation cascade, which is basically stabilizing your platelets plug, right?
Yes.
Yes.
Okay. So what happens first of all, for example, if you have an endothelial injury, first of all you are going to see subendothelial collagen exposure, then you are going to see,
The
okay,
colon one releasing.
okay, one valent factor,
Yes.
right?
Yeah.
Okay, they are going to attach to a receptor that is GP1B, right?
1B.
Okay, then
Yes.
what happens, you are going to see attachment of platelets, right?
Yes.
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 Platelets are going to attach to other platelets via receptor. What's the name of that?
2B.
GP
To be
GP2B
3A.
3A.
2B3A. Perfect. Okay. So, for example, if a person is having any problem with GP1, he is going to develop a condition. What's the name of that?
Bernard Soiler.
Okay, perfect. Bernard Solier. Okay, and for example, if we have certain mutation that is affecting the, okay, Glenn. Okay, so how do the platelets attract other platelets? Is going to release certain substances. What's that? ADP.
Box ATP.
Okay. What about? Okay, it's going to release
Need
calcium
release
plus. Okay,
calcium.
thromboxane A2. Okay, a drug that irreversibly inhibits thromboxane A2. What's the name of that?
Aspirin. Aspirin.
Okay,
Aspirin.
perfect. Let's be quick. Okay, so these two platelets are going to be attached with one another, and here an intermediate substance. What's the name of that? Fibrin, right?
Fibrin.
Fibrin, perfect. Fibrinogen is going to be converted into fibrin, and it's going to adhere both of these platelets with one another. Okay, for example, first now we will be discussing disorders of primary hemostasis that is related with your platelets. Okay, for example, if we have less platelets, we will be seeing bleeding. Bleeding would be superficial or deep.
Superficial.
Okay, superficial. Perfect. So we are going to see petechia, ecchymosis, purpura, right?
Yes.
Okay, what's the normal platelets count?
100.
Okay, what's the normal bleeding time?
2 to 7 minutes.
Perfect, 2 to 7 minutes. Okay, so the first condition which we will be discussing, ITP. Let me just give you a brief overview of ITP. Your spleen is going to make IgG. IgG is going to be attached to your platelets. Platelets are going to come into your spleen again. The reticulocytes are going to eat your platelets. Platelets count go down. So we'll be seeing bleeding, right? We can see bleeding superficially, that is in the skin we can see. So it's going to give you purpura, right? So immune thrombocytopenic, it is immune mediated. Thrombocytopenia, less platelets, information of purpura. Okay. So what would be the, okay, just remove the spleen, right? It can help immune thrombocytopenic purpura, right?
Yes.
Okay, this IgG would be against which receptor in platelets? Yes. GP2B3A.
GP2B 3A.
Okay, high yield, you must remember it. Okay, so there are basically two forms of ITP. One is acute and other is chronic. Okay, acute basically happens in, yes, children, right?
Yes.
Right after viral infection or immunization. Chronic in childbearing women, and it can also be secondary due to SLE as well. Okay, so can you guys tell me the laboratory finding? What will happen to PT and PTT?
Normal.
Normal.
Nothing. Okay. What happened to platelets count? It would decrease. Okay. What are some of the treatment options? Splenectomy, right? And what's the other treatment option? Just distracting your
Angiogram.
spleen. IVIG. And how do the IVIG work, please? Hello. How do the IVIG work?
It, it distracts the spleen.
Perfect. It distracts your spleen. Okay. Now let's discuss another condition, that is MAHA, micro angiopathic, micro small angiopathic blood vessels, hemolytic anemia, red blood cells being breaking off. So in microangiopathic hemolytic anemia, you are going to see these meshworks of platelets, thrombus. Whenever the red blood cell pass through these, they would be cut off in between. It's going to form a helmet cells. What is the other name of helmet cells?
Histocyte.
Histiocytes.
Okay, schistocytes on peripheral smear.
Histocytes.
Okay, so the main idea is that you are going to see platelets plugging inside your small vessels, and it would just shear off your red blood cells. So can you just tell me some conditions in which I'll be seeing these platelets plugs?
TTP.
Okay, TTP and HUS. Okay, what
HUS.
is TTP? That is thrombotic thrombocytopenic turbo, right?
Thrombolytic
Okay,
purpura.
what happens in TTP? Adam TS13
Against TS13
antibodies
inhibition.
against. Perfect. Antibodies against Adam TS13. What is Adam TS13? It basically cleaves off your multimer of your
One labyrinth.
non-valent factors. Okay, whenever they are okay, and it would convert them into monomers. Whenever they aren't converted into monomers, so it would activate your platelets exaggeratedly. Whenever your platelets are activated exaggeratedly, exaggerated activation of your platelets is going to give
Thrombosis.
you this condition, thrombosis, small vessels. So now it would just give you anemia as well. So this condition, thrombotic, thrombocytopenic purpura, simple. Okay. So Adam TS13. Okay, another condition, HUS, high yield. You might have seen a lot of MCQs related to HUS. In HUS, hemolytic uremic syndrome. It's basically due to E. coli, right?
E. coli.
Yes.
Yes.
Okay. Okay. E. coli is basically it is found in undercooked beef. It's going to activate your platelets in small vessels, right? And as a result of that, you can see microangiopathic hemolytic anemia, right?
Yeah.
Okay. Can you just tell me other conditions which are associated with HUS and TTP?
DIC.
Okay. Okay. Yes, DIC.
Neurological symptoms like
Yes,
confusion.
neurological CNS symptoms. Yes. For example, if I am blocking of this vessel, it means it can also cause,
Renal insufficiency.
yes, insufficiency, renal insufficiency as well. Okay. Okay. It would cause skin and mucosal bleeding, superficial bleeding. Why? Because I am just losing all the platelets here.
Can't hear
If I
you.
am hello,
I can't hear you.
Consumption.
Dr. Rafiq, can you mute?
hello.
Yes, we can hear you now.
Okay, so it means I am consuming all the platelets. If I am consuming platelets, so the platelets drop down in my blood. Simply, if I am consuming them, so there would be increased chances of what? Superficial bleedings, right? That is skin and mucosal bleeding. So it can cause skin and mucosal bleeding. What would be the laboratory findings? You're going to see thrombocytopenia inside the blood. What happens to the level of platelets? That decreases. Why? Because they are used off.
Decrease.
What happens to PT and PTT?
Did you say?
No.
Did you say DIC?
DIC?
Did I hear DIC? No.
Where?
Here in this. Someone said DIC. No.
Okay, DIC can cause this microangiopathic hemolytic anemia as well, because in DIC you are going to see again, you are going to see fibrin clots, and as a result of that, you can see microangiopathic hemolytic anemia. Simple. Okay, so what happens to PT and PTT, guys?
Normal.
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 Okay, it would be normal. Okay, so we'll be seeing schistocytes as well. Why? Guys, be quick.
Because of
Destruction.
destructions with narrow
Okay,
vessels.
perfect. Okay, so can you guys tell me? Okay, the Bernard Solier is related with deficiency of genetic deficiency of which receptor?
GP1B receptor.
Okay, Glanzmann's thrombocythemia related to which?
GB2-3A.
Okay,
2B3A.
perfect. So now let's discuss secondary hemostasis. So in secondary hemostasis, basically we deal with the fibrin or the coagulation cascade. So basically we have
Cascade.
two cascades, that is extrinsic
Yeah.
and intrinsic.
Intrinsic.
Extrinsic is basically activated by your tissue factor,
Tissue.
your factor 7, right?
7.
Yes.
Yeah.
And intrinsic, your factor 12.
Yes.
12.
The
Absolutely.
goal of both of these cascades is to ultimately
Common pathway.
Okay.
activate your
Factor
factor
10.
10. As a result
10.
of that, you are going to see conversion of
Trophy.
fibrinogen into
Fibrin.
fibrin,
Fibrin.
right?
Then
Simple.
thrombin.
Okay, it's going to give you thrombin, prothrombin. Prothrombin is going to. Okay, there is some noise in someone mic. Please, can you just. Hello. Okay. So, okay, now let's discuss the disorders which are associated with secondary hemostasis, right? Okay, we also need calcium and phospholipids surface for activation of these cascades, right? So now let's
Yes.
discuss disorder of secondary hemostasis. So the first disorder which we will be discussing is okay. Whenever we have disorders of the coagulation cascade, we are going to see bleeding. That bleeding would be superficial or deep.
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 Perfect. So we are going to see deep bleeding. Okay. Right after surgical procedure, for example, if I'm extracting the tooth, so again it would cause bleeding. The bleeding would not stop. Simple. Okay. So we have PT and PTT. So what is PT and what is PTT? Prothrombin time.
Prothrombin time.
It's related with which pathway mostly? We were extrinsic or
Extrinsic.
Intrinsic.
Fiber hemostasis.
extrinsic or intrinsic?
Extrinsic.
Okay, extrinsic pathway.
Extrinsic.
Extrinsic pathway. And it's related with your intrinsic pathway, right?
Intrinsic.
Yes.
Can you just tell me the common factors in both of them?
10,
Okay,
Factor
10.
6.
10
10,
is common.
10, 5, 2.
5.
5 is also common. 2 is also
2.
common.
1.
2, 1. Okay. These are the common factors. So you guys must remember this because in certain disorders we are going to see both of PT and PTT is going to be affected. So we are going to refer to this slide again. So the first condition which we'll be discussing is hemophilia A. Already discussed what
A.
happens in hemophilia A.
Deficient of A factor. 8 factor.
Factor 8. Okay. So the bleeding would be deep, right?
Yeah.
Yes.
Okay, and A is basically the main factor for which pathway, extrinsic or intrinsic?
Intrinsic.
Intrinsic. So we are going to see prolongation of your PTT, right?
Yeah.
Yes.
PTT.
What happened to PT? It would be normal.
No.
Okay. So what happens to the platelets count and bleeding time?
Normal.
Nothing.
Normal.
Yes, normal. Bleeding time. Okay, and what's the treatment? Give them factor 8.
Yes.
Okay.
Yes.
So can you guys tell me what is Christmas disease?
Hemophilia B.
Okay, hemophilia B. Hemophilia B. It's also known as Christmas disease. It is due to factor 9 and it resembles hemophilia A. Why? Because
Both
in
involved.
order, yes, it's also like component of your extrinsic pathway and it can act as a cofactor. Okay, in this pathway. So basically,
Yes.
it resembles your hemophilia A. So coagulation factor inhibitors. So can you guys tell me that? Okay, okay, factor 8. Okay, first of all, let's discuss another disease that is von Willebrand factor disease. So, for example, if one have genetic von Willebrand factor deficiency, so what do you think, guys, would happen?
No
Okay, what happened to
adhesion.
bleeding time?
Increase.
Increase.
Okay,
Increase.
what happened to PTT and what happened to
In-
PT?
Increase BTT due to
In-
effect of
Why?
factor 8.
because of factor it is.
Yes, like basically in the Weeble palate bodies we have already discussed, you are going to see the von Willebrand factor and factor 8. So it basically increases the half life of factor 8. So they both of them are found in association with one another. So it means we are disrupting the intrinsic pathway, right? As well.
Yes.
So what happens to
Yes.
PTT? It would prolong and there won't be any effect on PT. Okay. So What's the treatment option for von Willebrand factor disease? Simply give them LDH analog. Why?
It's more present.
because it increases
Promotes
hormonal blood cycle.
promotes secretion of
Okay, it
vulnerable
promotes
factor.
secretion of von Willebrand factor from weevil pellet bodies.
Yes.
Perfect. Okay, so now you guys are going to tell me vitamin K is going to give you certain factors. What's the name of that
Figure
already discussed?
19 SC.
1972,
Yeah.
right? Factor 10, factor
Yes.
9, factor 7, factor 2, right?
And
NSC.
Okay,
proteins ST.
sorry.
AC.
Proteins ST.
Okay,
Anticom.
so
Yes. Yeah.
sorry, I didn't hear.
Also,
CNS
protein C
proteins.
and protein S.
Okay, protein C and protein S. Okay, perfect. Perfect. That's perfect. Because okay, so let's okay, we will be talking it later. Just leave it for now. So vitamin K is going to come into your liver and it is going to be activated by which enzyme?
Epoxidized
So,
reductase.
Okay, epoxide reductase. Can you just give me example of one of drug which is acting somewhere here?
Warfarin.
Okay,
Warfarin.
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 Okay, it inhibits epoxide reductase, right?
yes.
Yes.
Okay, you guys should know that we'll be discussing it in our later segment. So K plus whenever okay, so if it's activated by epoxide reductase, what's K plus going to do then? Activated K plus.
Gamma carboxylation.
Okay, it's going to undergo gamma carboxylation of factor 2, 1972. Simple. Okay, and
Yes.
protein C and S. Okay. So, for example, if a person is having some deficiency of vitamin K, what can be there? Those conditions. For example, if you have a newborn baby, he do not have enough GI flora in order to make K
Yeah.
plus,
Neonatal
right?
bleeding.
Yes, bleeding. It would cause neonatal bleeding. Simple. So we can prophylactically give them K
Oh,
plus
yeah.
injection.
Vitamin K1.
Yes. Okay. What about long-term antibiotic therapy?
Deplete normal.
Decrease vitamin K.
Yes, it would deplete the normal gut flora, and normal gut flora form your K plus. Okay, again you'll be seeing some bleeding. Okay, okay. Let's talk about warfarin. You guys know, for example, if I am giving a patient warfarin, first of all I must make a heparin bridge. If I didn't make a heparin bridge, what's going to happen? Just tell me all of the phenomena.
There will be hypercoagulable state and it will cause stress in necrosis.
Okay, how? Just give me a good
Because
example.
It's rapid acting
okay,
heparin.
because it is first of all it is decreasing the protein C because protein C has a short half life rather than the
Okay,
procoagulation factor. These 1972 it will deplete later. So
perfect.
yeah, because of the protein C deficiency, first there will be a hypercoagulable state because of these procoagulate factors, and it will lead to hypercoagulable state in the initial phase that will cause us to skin necrosis.
Okay. So basically, protein C and S inhibits your coagulation cascade, right? It inhibits factor 5. Remember?
Yes.
Okay, and they are made up of K plus simply as we talked. So if I'm inhibiting of the epoxide reductase, inhibiting K plus, it means all of these 1972 along with C and S is going to go down. But they have short half life. They would go down quickly. So if they go down quickly, it means you do not have C and S in order to inhibit coagulation. So you are going to see extreme coagulation, especially in skin. So it would cause warfarin skin necrosis. One high yield, you are going to see an MCQs in you world. You might already have done MCQs related to warfarin skin necrosis. There are multiple MCQs on this concept. Okay, so now let's discuss a condition that is DIC. What's DIC?
Disseminate
Disseminated
intravascular
intravascular
coagulation.
coagulation.
Okay, disseminated intravascular coagulation. Can you just tell me some of the diseases? It's always secondary to some diseases. So can you just tell me some of the diseases
Sepsis.
which can cause? Okay, sepsis.
Etc.
Perfect.
Obstetric
Obstetrical
complication.
Okay, obstetric complication. Perfect. Because from the
Peritonitis.
nephrectomy.
amniotic fluid. Okay, from the amniotic fluid, like you can see, going of the tissue factor
Emboli.
and would activate your tissue factor is going to activate your coagulation cascade. Okay, We
Yes.
discussed about Atrozu syndrome. Adenocarcinoma is going to give you thromboplastin, and ultimately it can activate your coagulation cascade, right? And it can
Yes.
cause DIC. What about in white blood cells, myeloperoxidase or rods? It can also leak off into your blood. It can cause DIC, right? Heat
Yes.
stroke. Again, some of the cells damaged, tissue factor is being released into your blood. You might have seen an MCQs related to heat stroke.
Yes.
Okay, and it can also cause DIC. Okay, so in DIC, first of all, what happens to the platelets count?
Decrease.
Decrease, because you are going to see activation of both platelets and both
Coagulation
coagulation cascade. Okay, what happens to PT and PTT?
increases.
Both increases. What happens to a level of fibrinogen?
Decrease.
Decrease,
Decrease
because it's used.
absence.
Okay, how to? Okay, you are going to see an elevation of D dimers. What is D dimers?
Bypass product of
Hybridization,
fibrinogen.
degradation.
Fiber split product. Yes.
Okay, it's bypass product or like okay,
Fibrin.
fibrin and fibrinogen as well. Okay, so now let's discuss disorder of fibrinolysis. So first of all, can you guys tell me that how does the fibrinolysis occurs normally?
Plasminogen converts to plasmin.
Okay, plasminogen converts the okay
By
plasminogen activator converts plasminogen into plasmin. Plasmin is going to degrade your
fiber.
fibrin
Fibrin.
plus
Mesh.
fibrinogen, right?
Yes.
Okay, so for example, if we have certain diseases and in which we are increasing the tissue activator or plasminogen activator, for example urokinase, you guys know in radial prostatectomy you are going to see increased urokinase levels, so it's going to activate your plasmin, right?
Yes.
Yes.
Hello, so what the plasmin is going to do?
Cleave fibrin and fibrinogen.
Okay, it's going to keep cleave
Dissolve
fibrin and
fibrin.
okay, it's going to okay. So can you guys tell me what happens to PT and PTT?
Increase.
Both of them would increase. Okay, so
Yes.
it basically resembles DIC.
Yes.
Okay, so
Mhm.
okay, so what's the treatment? Just give them aminocaproic acid because it blocks the activation of plasminogen. Give them aminocaproic acid.
Capronic. Capronic acid.
But here there is normal platelet count, unlike
Yes,
this.
the platelets. Okay, you're saying the platelet. Yes, the platelets count is normal. Yes,
Yes.
that's important. Platelets count is
Yes.
basically normal because you are dealing with the secondary hemostasis pathway, PT, PTT. Okay, so
Mhm.
let's discuss thrombosis. Okay, I think these are very general terms. Thrombosis. Okay, what's virtual triad? Anyone who can just tell us what's virtual triad?
At tag.
Endothelial range.
Okay,
Blood stasis, hypercoagulable state, and
okay,
endothelial damage.
okay. So immobile state, second endothelial
Injury.
cell damage, and hypercoagulable state. These three things, these three triad can cause thrombus formation, right?
Yes.
Okay, so thrombus basically can be formed mainly everywhere. For example, it's like deep veins are like more prone to development of thrombosis. That is DVT, deep vein thrombosis. It can also cause thrombus
DV.
in the veins as well, like somewhere, for example, in the hepatic vein. So normally your endothelial cells, okay, just sorry. Normally your endothelial cells have certain mechanism which avoid the formation of thrombus, like mechanisms of endothelial cells that avoid formation of thrombus. What are that? For example,
Frequency
first of
hepatic.
all, the endothelial cells have covered the subendothelial collagen, which can act as a tissue factor, right?
Yeah.
Yes.
Okay, whenever they are
Yes.
disrupted, if you are exposing the tissue factor to your blood, so it means you are going to activate your which pathway? Extrinsic pathway, right? And it can cause
Extrinsic. Yes.
thrombus. Okay. Similarly, you also have certain okay, you also have certain antithrombin. Okay, do you guys know what is antithrombin 3 as the name indicates?
Antithrombin 3. Anticoagulation.
Okay, it's like
heparin,
antithrombin. So it inhibits the
thrombin,
thrombin formation. Okay, and can you just tell me a drug which activates your antithrombin 3?
heparin.
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 Perfect. Okay, heparin is going to activate your antithrombin 3. So the endothelium basically release certain substances which resemble antithrombin 3. So in this case, it can also avoid the formation of or the activation of your coagulation cascade, right? So thirdly, you can also see like okay, so it also secretes tissue plasminogen activator as well, TPAs. So in this way, it's also avoiding the formation of those plugs, right? As we have
Yes,
discussed. Okay, we have also discussed protein C and S. They are going to inhibit your factor 5 and factor 7, right?
yes,
So in this way, it can avoid the formation of or the overactivation of your coagulation cascade, right?
yes,
Okay.
Yes.
So the endothelial damage can occur in various ways. For example, if a person just damages the endothelial cells, it means you have damaged all of the protective mechanism, and now this person would be prone for the formation of thrombus, virtual triad. One of the thing is gone, that is endothelial damage.
Yes.
Okay. Secondly, for example, do you guys know what is homocysteine?
it's caused
Hello.
by it's
Yeah.
caused by folate and vitamin B12 deficiency.
Perfect. So whenever the levels of homocysteine rise inside your body, it can also cause endothelial damage, right?
Yes,
Okay. The increased homocysteine level, as the doctor told us, it is basically due to vitamin B12 and
folic acid
folate
deficiency. Yes,
deficiency, folic acid deficiency. So how do these both of their deficiency causes increased homocysteine? For this, you must know the normal pathway which is normally involved. For example, you know the folic acid is going to give you, it's going to be the part of your DNA, right? So it's going to be converted into tetrahydrofolate, right?
yes,
Methyl is
Yes.
going to bind to tetrahydrofolate. This methyl is given to your B12, and tetrahydrofolate participate in formation of your DNA, right?
yes,
Okay, so methyl. So the B12 give this methyl to your homocysteine, right?
yes, and give also
It's
methionine.
yes, and it is converted into methionine, right?
Yes,
If we do not have this folic acid, if we do not have B12, it means we cannot convert homocysteine into methionine. So homocysteine is going to build up.
yes,
It's going to cause endothelial damage. And
and
again, if we have
no
endothelial
DNA synthesis.
and what?
No DNA synthesis.
Yes, no DNA synthesis as well. No folic acid, no B12, no DNA synthesis. Okay, so this was all about. Okay, so now let's discuss hypercoagulable state. After that, we are going to discuss embolism. Okay, so in guys, in hypercoagulable state. Okay, so we have discussed this one endothelial damage. Now let's discuss hypercoagulable state. So, hypercoagulable state can be formed, like for example, if a person is living a sedentary lifestyle, okay, like after post-surgical conditions, if he is immobile, so it means he can cause, he can have hypercoagulable state, right? And it can increase the chances for development of thrombus, especially in the deep veins. So it can cause DVTs, right?
Yes,
For example, if we have protein C and protein S deficiency, we have already discussed that protein C and protein S basically it inhibits factor 5 and factor 7. If we have deficiency, it means these factor cannot be inhibited. So again, you are going to see increased formation of thrombus, increased chances of formation of thrombus, right?
yes,
Okay. So okay, so Okay, we have already discussed the warfarin concept in this. For example, if you are giving warfarin, you are inhibiting the all of the derivatives of vitamin K, and as a result of that, half life of CSS and S is less, so it can cause warfarin skin necrosis. So we can first of all we have to give them heparin bridge, right?
Yes.
Okay. For example, if we have a condition that is we have mutation of factor 5 and factor 7, it means it cannot be inhibited by C and S. So that is basically known as factor 5
Lady.
laden. Laden. Okay, if we have mutation. So it means it cannot be inhibited by C and S. If it's not inhibited, it's going to cause increased chances of thrombus formation, right? Again,
Yes.
you'll be seeing DVTs, you'll be seeing thrombus everywhere inside your body. Simple. Okay. So, for example, if you have anti-thrombin 3 deficiency, what do you think, guys? You're not inhibiting your thrombin, you're overly activating your thrombus formation. So, it can also cause thrombus, right? DVTs. Hello?
Yes.
Okay.
Yes.
So, now let's discuss embolism. What's embolism? It's simple. For example, if this thrombus dislodges, it would become an embolus. So it can go everywhere in your body. For example, it can enter. For example, we have discussed that it can enter into pulmonary vasculature, right? And it would cause pulmonary embolism. For example, if this person is having some atrial septal defect, then we are going to,
Paradoxical.
yes, paradoxical emboli. It can cause paradoxical emboli. For example, we have done a lot of MCQs in our world. For example, if a person is having some pelvic fracture, we have discussed it right in our class, or some bone fracture. So you can see
Pelvic area.
embolization of marrow, bone marrow, and that would be an example of fat embolus, right?
Yes.
Okay, so it can cause fat embolism. You can also have a gas embolism as well. In which condition are we going to see gas embolism? Hello.
Iatrogenic.
Sea divers,
Decompression sickness.
Okay, sea
nitrogen gas.
divers.
Okay.
Okay,
Decompression sickness.
if I'm just injecting an empty syringe full of gas, it can also give us gas embolism. Simple. Okay, so like in sea divers, what happens if they are they can form nitrogen gases that can be precipitated in your blood, and that can emboli anywhere inside your body. Okay, we can also see amniotic fluid being embolized, amniotic fluid embolus as well, right?
Yes.
For example, if the amniotic
Yes.
fluid just like it enters the mother circulation and it embolizes somewhere and it causes obstruction. Okay, we can also see septic embolus, guys. Septic splinter hemorrhages in cardiovascular. How can you forget that,
Yes.
right? So, okay, so last topic, that is our pulmonary embolism. Okay, so what happens in pulmonary embolism, guys? For example, if from the DVT the emboli dislodges and it comes into your pulmonary vessels, we have already discussed in pulmonology. If I am, we are going to see weak mismatch, right?
Yeah.
Mismatch. Yes.
And it would be an example of, yes, a shunt or dead space.
Shan't.
Shunt.
Dead space.
Dead
Dead
space.
space.
Dead space.
Hmm. It would be an
Physiological dead
example
space.
of dead space. I am having the air, but I am not having any perfusion. Air without perfusion is dead space. Okay. So, for example, if I want to see the DVT, what's the ultrasound that is known as Doppler ultrasound, right? It's going to show you the DVTs.
Yes.
Hello.
Yes.
Okay.
Also,
Yes.
So,
there's D-dimer test.
okay, D dimer test as well. Already discussed. If you have DVTs, it means the D dimers are going to be elevated. You are going to see increased activity of your plasmin, right? And it's going to
Yes.
give you increased D dimers as well. Okay, so it can also cause sudden cardiac death. For example, if it directly the emboli and can cause a saddle embolus. Okay, it can also the embolus can also enter. For example, we have discussed in our mitral in atrial fibrillation. That is the emboli being built in the left atrial appendages, right? It can emboli
Yes.
anywhere, especially into your CNS, and renal,
appendix.
and can cause
Renal.
infarction of these organs, right?
Yes.
Okay, so thank you guys. This was all about hemostasis. Tomorrow we are going to discuss red blood cells. Okay, first of all, we will be discussing tomorrow. We will be discussing white blood cells. Then we will be doing red blood cells, right?
Okay.
Okay. So tomorrow is your off day. We'll be taking our classes, daily classes, but no schedule. Just do revision. Hello.
Okay.
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 Okay, got it.
So tomorrow we'll be taking our classes, but no revision. No, sorry, just revise. No
Task, no task.
extra
Tomorrow
tasks.
is the
Yes.
task
So
3 of
is it,
So we
dermatology.
are
sir, is it 1 or 2 hours or is it longer tomorrow?
It would be okay. I'm like, as I'm also discussing the microbiology side by side, so I cannot skip that. So it would be 2 hours. We can just do
Okay.
it slowly because we can't,
Okay.
like, we are already done with antibiotics. We'll be finishing off our gram positive within 1 or 2 days. Then we'll be finishing gram negative within 3 days, right? So we
Okay.
cannot do that as well. So we'll be taking 2 hours of daily classes from now onwards.
Okay.
doctor.
Okay.
Doctor, are
Okay.
you going
Yeah.
to
Thank you.
discuss about cancer drugs because we are facing a lot of problems in WBC
Yes,
and
please,
cancer drugs.
Okay.
Dr.
Yes.
Ahmed.
Yes. Yes.
Yeah,
Okay. Okay.
I
I
want
do
Cancer
to
have
ask
drugs,
that
questions.
yes.
will
Okay.
the
So
oncology drugs is filed?
yes, they're
Oh,
high
how
yield.
can we
You guys
stay?
have. Okay. So
Um,
one thing you guys can do that tomorrow I will discuss those drugs with you. But one thing which you guys must do is to practice Ankis for that. And I am just on that. Okay, guys can just open some decks. Okay, and you can just practice these drugs. You can just activate your Ankis card for these drugs.
So tomorrow we'll discuss by Anki onco drugs.
No, tomorrow I'm going to take class for those drugs, and then you are going to revise it again and again in your Ankis. Just open those decks.
Okay.
So when we can use our Anki?
Sorry.
When? When? When can we use our Anki? From today?
Yes, you can just open one of the deck that is Anking, I guess. You can just open those drugs. You can just enter the
Can you
hematology section again.
sorry, can you share with the link or we just download from App Store?
You just download your Anki. Dr. L Futures, do you know how to activate Ankis and all of those things? Okay, so can you help her, please? Dr. Nuria, I guess.
Yes. Thank you.
Okay, so please
yeah,
contact
so
Dr. L Futures. Those who are facing difficulties with activation of Anki's card, so Dr. L Futures, please help them. It would be really.
And
Hello, hello, doc.
Yes.
So,
Okay.
hello,
So
doc.
just activate.
Last
Yes.
question, doc.
Yes, Dr.
So,
Vivek.
doc, what's going to be in the grand test? Like, it going to include microbiology as well?
Yes, I'll be adding the microbiology as well because we are already done with these drugs. And
Okay.
we'll be having MCQs from microbiology. I'm
So,
planning to.
it
Yes.
includes cardiovascular and everything also, right,
No,
doc?
no, 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 not
No,
cardiovascular. Pulmonology,
pulmonology and
immunology, hematology, dermatology.
thank you, doc.
Yes.
doctor, you are
Okay.
also telling that you are making and decks for
Anki cards. Yes, yes.
yes, yes.
I have just
So,
hired one of guy today. He's
okay,
just uploading that into the decks. So
okay,
he's on his, like, we're on that work. Just for now, you can just use the
Doctor,
Anki
what about the assessment explanation?
assessment explanation. Okay. So once I just make the assessment, I'll send the explanation to Dr. L Future. L Futures, I'll send you the explanation. You can just share them right after the exam, right? Because
What about the
I
old
usually
ones?
forgot to
Yes.
share old ones. Okay, I've already shared that with L Futures as well. The old one, Doctor. Please share that. Okay, Dr. L Future, can you share that? I think I've just shared one of the old assessment with you. Actually, I didn't get time for that edit, so it means, guys, I'll be sharing it in raw form. So sorry for that. Just look for the
No problem.
explanations.
Just
Just
we
look
can
for the
just follow all the
explanations.
old ones.
And sorry for the edit. And in the next, I'll just edit it with as I just make those MCQs. I'll just keep on editing. So for now, you can use the raw form. Okay. So Dr. If you just please
Doctoral
send me.
futures can use share it in the group. Okay, it's for all the three assessments which we had before.
It's only for one assessment, one grand assessment.
So what about the other one?
Yes, I'll just search them in my Mac. Okay, and I'll just send that.
Can you please send other two even in the raw form?
Okay, sure. I'll just share them. I'll just search in my Mac. If I found them, I'll just share them. I have, but I have to search them, right?
Yes, please. I'm waiting for it.
Okay, so after this, we are going to start. If you guys remember, we are going to start our. Okay, we are going to start MSK, and in between MSK, we'll be practicing NBMEs, right?
Yes.
Every week we'll be practicing NBMEs, and I'll be making those NBME. Okay, I'll be just arranging those NBMEs, and those systems which we are done, we are going to have MCQs related to those systems, right? Okay.
Okay.
So thank you guys. So this was all about today's lecture. So please just revise all of your course that is included in your grand assessment, and this time we are going to share the complete result in the group. So please, okay, I'll be making your assessment, and it would be quite tough. Okay, just be prepared for that. Those who got 40% are going to pass that. Okay,
Okay.
okay, 40% would be passing, or just leave 40%, 30% is you're passing.
Come
Okay.
on.
Okay.
Yeah. Okay, I'm just kidding. It would be quite simple. Okay, don't worry. Okay, thank you.
Thank you.
Thank you,
Thank
guys.
you.
Thank you,
Have
sir.
a nice
Thank
day.
you.
You won't be having any task. Please, Dr. Futures or anyone else, just drop a text in the group, please. Okay. I'll try by myself. No task for 2 days. Yes. Yes. And but we are going to have class, no task with classes, with boot camps, right?
Okay. Yes.
Okay.
Okay.
Thank you, guys. Thank you. Have a nice day. Thank you. Yes, tomorrow and the other day. Yes, Thursday and Friday, no task, but class would be there.
Okay.
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 All right. Thank you. Have a nice day. Bye
Thank you,
bye.
doc.
Bye.
Thank you.
Thank you.
Doc.